job today is it to help you turn around? Is it to help you to create an understanding of what the future might hold? So that's why I brought some trends about the future of digital health. Ubiquitous Healthtech, the handheld hospital. And I'd like to start with a little story and the evolution of mankind. As you know, we grew up, we went to agricultural culture and to the information age, where we actually sit in front of the computers, and now it's transforming. We're having laptops, we're moving around with our smartphones, and actually what is also already here is augmented reality. The glasses we are wearing, which actually interacts as a connection between humans and machines. And the vision for this augmented wear is pretty clear. It is a new connection to information which you normally look up on your computer. It's probably easy or hopefully easier to use. It reduces complex ways to look it up. It should be smart. So the vision is clear, but how actually can it be used in reality? So I brought a couple of examples to show you this. This is the first one.
Okay, Glass, patient status. Okay, Glass, check vital signs, bed 4. Okay, Glass, increased SIVO, 2%. Very cool. I've been reading about it. I wanted to see what it was all about, and it was even better than I thought it would be.
So this is the first example I'll show you. It's created by Philips Healthcare in teamwork with Accenture and Google Glass. We call them datasexuals. We had the metrosexuals, and now we have people who love quantified self and wearable tech. And I'll tell you what it's all about with a little story. There are two people, Gary Wolf and Kevin Kelly, here on stage. They started back in 2007 to have a little coffee with friends and talked about their metrics for their body. And they invented the term quantified self. So they wanted to have metrics about how they perform over the day, what is their blood pressure, how to measure steps and everything. So this started this wave of new ideas into activity trackers and all this stuff. So the datasexuals, they track when they do sports, when they do jogging, the speed, the distances, temperature, for example, the terrain, if it goes uphill or downhill. If they go biking, they can measure the speed or the laps they are taking. But also in a daily routine, they track times. So how long did it take me to go from A to B, or when is my next meeting, how did I perform on that, did I reach my goals on time and everything. Or the body scale, which has been mentioned already, where you can check your BMI. These are all things the datasexuals actually track. And the bigger the data, the sexier it becomes. Going one step further, there's a company called Forward Health, and they're actually using these data to lower your insurance prices. And when you're now at home with all your devices and all these apps, you get in trouble because you have all these different apps, so you need a platform to actually get it all together. And there's TickTrack. And that's the platform, a dashboard, a personal dashboard where you can basically get all the different information on one place. What you're actually doing as a datasexual, you're creating a body area network. So a whole new monitoring system around your body, and logging and recording all types of vital signs. Orchestrated data. It's all about big data analysis and remote healthcare. And I also brought one story I'd like to tell you. And it starts with Foursquare. And what Foursquare did is they analyzed all these different data, and they have different categories like nightlife, food, work. You can basically define where you are and in which category it fits. And this is how it looks like if they analyze it over a day here in Manhattan, New York. So you have in the morning, what time is it? 11 a.m., 12 p.m., 1 p.m., you see a lot of yellow. That's actually professionals, other places, and then it turns into blue, which is nightlife, bars, restaurants. Red is food, as residents, for example, that people go home, check in there. So that's a massive stream of information of all these check-ins. That's all about big data. What do you do with this data? So now we have this video, but what does it tell you? So with big data, actually, it's all about what do you get out of it. It's not only tracking your vital signs and other information or like Foursquare location. It's also about how do you have algorithms, how do you create algorithms who create kind of an artificial intelligence around it, who probably give you signals what to do and how to act on it. Another vision which I find is worth mentioning today is a project also funded by Google. It's called the glucose sending contact lens. Another example on wearable sensors, which is probably the next step of the Sensium patch, is a biostamp, an electronic tattoo. So the University of Illinois have created this little tattoo which you, or the little stamp you put on, and it's even movable. So you can, it's a little bit like these little tattoos, you know, from your children you put on with a picture or something with a little water, and then you turn it off. Of course, if these sensors are becoming so small, why not digest it? So these little pills have a sensor on top of it. With the trend, actually, I'd like to point out that it's not about the data itself, it's about orchestrated data. And you are the dirigent, yeah? You are the person in charge, you're the leader. So you actually, your challenge will be to not only create a stream of vital signs from your patients or from the products you're using, it's also about how to make smart predictions, how to analyze it in a smart way, so how to orchestrate this data. It's called Crowdmarket, and about the presumers and crowdfunding. I'll tell you this story about Nikolai and Mario, the two startup founders based in Munich, and they produced the prototype of this little earplug. It connects wirelessly to your mobile phone, you can transmit your music. But it also has some sensors inside, so you can basically track vital signs as well, and activities, steps, movements. At the beginning, they just showed it to the consumers on Kickstarter. And within 10 days, they raised over $3 million by presumers. So consumers, like you and me, who actually buy the product in advance, pay today, and get the product probably next year or at the end of the year. So they are raising money by selling the product advanced and also testing if anybody wants it. The whole market of crowdfunding is almost $3 billion at the moment. There are a couple of types of these crowdfunding campaigns. So one could be the presumers, so actually where you sell a product in advance and then it takes a couple of months until it's actually produced. There are equity funding, so you could go out with your startup and say, I'll sell parts of my company as an equity, and the crowd, the people who invest, become investors and take a little part of the company. There are also charities and lending platforms, so you can actually have a crowd-funded credit, for example, to support the idea. The empowered patient. It's about the knowledge communities and the do-it-yourself healthcare. And I'll start with another example.
Smile. No, I'm not taking your picture, I'm taking my picture. Not my face, my body. Not the outside, the inside. This got weird, let me start over.
See this iPhone case? It's more than just an iPhone case. It's a powerful health monitoring device. These are the sensors where my fingers go. I put them here, and I wait a few seconds.
Now I have a snapshot of my health that looks like this.
So this is another company called Velo, and it's actually $200, so it's probably a cheap solution to track these vital signs. But there's another one I'd like to mention. They're doing pretty innovative stuff.
Technology has given us an unprecedented window into the human body. But on a day-to-day basis, we're still in the dark about our own health. We are changing that.
You okay? Do you feel okay?
What if instead of fearing the worst when you notice something out of the ordinary, you could identify the condition yourself? Getting the right diagnosis would save you worry.
It says it's roseola.
And an unnecessary doctor's visit.
Rest at home, it's okay.
So this is the vision of a company called Scanadu. And their first product they started is called Scanadu Scout. And it's a little tricorder. And they also started with a Kickstarter campaign to finance their idea. So they started out with this little visionary video and ended up with a real product. It's all about speed, and if the speed actually creates an opportunity. And I brought this example of the city. It's Seoul. And it's one of these innovation hotspots on Earth. And if you look in this hotspot, it's actually a place where the future is already here. So as the author William Gibson said, the future is already here. It's not just widely distributed yet. On planet, we have over 7 billion people and over 7 billion mobile subscribers as well. We have over 2 billion mobile broadband users, 3 billion internet users, 1 billion active Facebook users, and 500 million, and even more probably now, using the messaging service WhatsApp. Why Seoul is important, it's the most connected city in the world. Mobile broadband is reality, with up to 1 gigabit per second. It's a hotspot also for mobile health. So if you ever had the chance to go there, that's a good place to look at examples. So we reached a tipping point with all these trends coming all together, with 4 unique factors which we have today: the global talent and knowledge sharing, the low cost of reduction, lean technology, smart development, low cost development, and new access to capital, like crowdfunding. And this gives me the opportunity to talk about the innovation hotspot. That's something you can create all together right now. So we heard about the Ubiquitous Healthtech, Datasexuals, Orchestrated Data, Crowdmarket, and about empowering patients. So there's one thing I can tell you right now: the future is now. Thank you very much.